can you pinpoint one moment in that you consider to be your bravest?
Do you know, I find this question so hard, and I've listened to all the other guests on this podcast answering this question.
Yeah.
Because this is the one question that I'm like, I don't know. And there's so many points, like, you know, where I went self-employed and feeling like I have to just try this. That was a massive thing for me. But I'll be totally honest, I struggled that much with the question of me being brave that I actually put a post out on Instagram, on my Instagram stories about this.
Yeah.
And I just asked the question, what does bravery mean to you? Can you share some examples of times you've been brave? Just to get my inspiration flowing.
Yeah.
And a lot of the people who follow me on Instagram are people living with PMDD or what I call hormone havoc. So not necessarily PMDD, but their hormones just give them jip every month.
Yes.
And so a lot of the responses that I got on my poll last night were about their PMDD. And so I guess to answer the bravery question, it's not just my bravery story, but I guess the bravery story of people living with PMDD. And one person said, just, you know, having to divulge that information at work and tell my manager, and also telling my family about it. And those are really, really good points, because I think, again, it's such a taboo thing, mental health, menstrual health. People don't want to talk about these things, particularly at work.
Yeah, it's just especially if you've got a
no
male
thanks.
manager.
Yeah.
Not all men, well, hashtag.
Yeah.
But it is probably the last bastion of things that people aren't comfortable talking about, I think.
That's it. And I think, you know, there's been so much progress, and, you know, you only have to look at like the menopause space, which is like so different now, isn't it? And like, you know, the rhetoric's changing, the narrative's changing, and that's great. But I think when it comes to you as an individual having to disclose and be vulnerable, that's really difficult to do. But I guess the brave thing for me, for a person with PMDD, every month you are basically stripped of your personality, you're stripped of your character, you're stripped of your fun, you lose your voice. And I describe it as like you're behind like a smoke screen, and you can see the way you're behaving, you can see your thoughts, and you can see what you're saying. You can't really stop it, even though you're like, this is a terrible idea, but I'm going to do it anyway.
Yeah.
And for me, the feelings are very much like hopelessness, like what is the point in anything? Now that is not my personality. Like, no. I love life, I'm quite a positive person, I'm a very positive person. But when PMDD hits, it can just zap you of any hope, any energy, any zest for life. And I think the bravery part there is because despite all that, you carry on anyway.
Yeah.
And you continue to function, and you continue to do the things that are expected of you, you know, like going to work and being a parent. You still show up and do all those things, but taking it even deeper, like you choose to stay alive. And I just think that is brave. That is so brave when your mind is telling you not to, when your mind is telling you to just put the cover over yourself and never leave the room again. You get up, you get out of bed, you brush your teeth, you go to work. And I think that is so brave, and I guess that is the bravery story of the person living with PMDD, that they carry on because that's what's expected of them.
Yeah, and that really is a daily fight, isn't it? And as you say, trying to fight your own mind like that is really difficult. I mean, I wouldn't say I've got PMDD, but I certainly suffer from those kind of thoughts when at those times of the month, and you're like, what's the point?
Yep.
What is the point? And then even though you probably know that that's what it is, there's a disconnect in sort of rationality, isn't there? Of you could tell yourself, well, I think it's this, but there's still something. It is a chemical imbalance, I guess.
Yeah, and to that point, I think that's the thing about PMDD that people don't realise. So it's all to do with the brain. So people think that PMDD is, you just said the word imbalance, people think that it's about hormones not doing what they should do, or they're imbalanced in some way, and actually the issue is in the brain. So my hormones are actually fine. I've got a typical menstrual cycle, there's no issues there, but it's the way that my brain responds to those fluctuating hormones in the body. That's what causes the symptoms, and it's all to do with the serotonin and how your brain absorbs it. And it's so fascinating, really, because there's a lot of links as well with PMDD to autism and ADHD, because I think it's a similar part of the brain. And so, yeah, it's fascinating. But actually, my menstrual cycle isn't the issue here. It's my brain.
Yeah. Well, I was going to ask you about that, because I've seen a lot that people who are neurodivergent particularly suffer with it.
Yeah.
So it's more of the brain chemicals, as you say, that are causing the issues.
Yeah. Which I mean, doesn't really make it any better, but doesn't make it any worse. It's just, oh great, okay, it's my brain that's the problem.
Yeah. So how do you go about tackling that? Is there anything you can do to ease the symptoms?
Yeah, so there's no cure for PMDD. The kind of last line treatment, if you like, is surgery, which is a bilateral oophorectomy, so the removal of your ovaries, which would stop you from having a cycle,
Right.
effectively putting you into menopause. So that's the last line treatment. But prior to that, there's things like chemical menopause, which is like a temporary medication that you can take. And there's the other side of the scale, which is, you know, your lifestyle changes. So, you know, I said before about I beat myself up for not walking enough and things like that, but we all know, don't we, that getting out in the fresh air is really good for us. So there's things like that can help. Something that's really helped me is SSRIs, so antidepressants, and for a person in PMDD, they're taken just in the luteal phase only. So
I was going to say you only take them in a...
That's right, yeah, so, you know, it's different from a person maybe who has depression taking them every single day. So that's something that's been really helpful for me, a bit of a game changer for me for my treatment pathway, really, because I think putting in that as a foundation, the medication as a foundation, has meant that the self-care has been easier to embrace.
Yeah.
You know, I don't tend to have those moments as much where I'm like, well, what's the point? What is the point in doing that? There's no point. I'm not gonna bother showing up for myself today, because the medication is almost like a stepping stone and gets me to that point where I can do those things then.
It becomes an upward cycle, doesn't it?
That's
Because I think I know that when I've been in my darkest moments, like trying to meditate or journal, I can't even take that first step to do that. So I really feel for people, because you've got a world of noise going, well, just do this, just journal, just have you tried thinking positively?
Yes, I think there's so much onus now on that kind of responsibility of the individual, and we've all got a responsibility to take care of ourselves, of course, but I think the danger of that is we then blame ourselves when we need support, or we think we're weak for needing support, or, you know, medical intervention, and that's just not true at all. If you're living with something like PMDD, which is a very real, very valid health condition, that's the whole point. It's a diagnosis, which means you probably need some sort of support with it.
And I think there's probably a lack of understanding in the medical community. I know from sort of the menopause side of things that most doctors only get, I think, 2 hours training on the menopause, and I'm guessing it's not much more for menstrual health either.
No, absolutely. And you know, my biggest advice for anyone who's listening to this and maybe is thinking, oh, you know, I want to speak to my doctor about this, is track your cycle first of all, so that there's a pattern that you can identify, but also take along, you know, the NICE guidelines for the treatments of these conditions, because it's things like that that can help your doctor to help you. You know, they're not the enemy, but you do need to help them to help you.
Yeah, you just got to advocate for yourself, basically,
definitely.
haven't you? Which isn't easy when you're feeling like that.
Yeah.
Because I guess before you had perhaps the medication, do you have like an impending sense of dread, thinking, oh, right, well, my good 2 weeks is nearly up. It must be really hard to live knowing that that's around the corner, month after month.
Yeah, so in particular, a time that was really difficult for me was when we were trying to conceive my daughter, because I would have 2 weeks of PMDD, and then the symptoms would go as my period arrived, and in place of PMDD symptoms was the disappointment of not conceiving. So that was a few days, if you like. And then when you're living with PMDD, you have trauma from those intrusive thoughts and the suicidal ideation. So you have to kind of put yourself back together again, and then before you know it, you kind of like, oh, I'm ovulating next week, so my symptoms are going to be back. And it's that impending doom of just like, this is me on my best day, and yet I'm still feeling anxious about what's to come, and I'm still feeling traumatized about last month. So getting to that point where you're just kind of like, you know, it's something that affects people for around 2 weeks of every month, but actually it's not. It's something that affects you every single day.
All the time, yeah. And how was that then growing up? Like, did it affect your relationships, friendships, and did you struggle?
Yeah, so I remember, like, at the age of 14, so, you know, I mean, it's a hard time anyway, isn't it, being a teenager?
Yeah.
Like, it's not fun. But yeah, I remember, like, when I was, like, 14, just, like, walking, and it was kind of, like, down the river where we live, and I just remember thinking, like, what would happen if I just walked into the water? Like, who cares? I'll just do it. And I didn't. But I just remember just knowing that I was just different, and none of my friends were probably doing similar things, you know, a few meters down the river way. That wasn't a thing that was happening. And so it was really easy to just compare myself to my friends who were, you know, very similar to me. You know, we'd grown up together, they had similar background to me, similar, obviously, education, similar lifestyle. Yet for some reason I was being so dramatic and hating myself. And so it was just one of those things where I felt really ashamed of how I was feeling and ashamed of myself, because, you know, my friends were really happy and I wasn't.
Yeah.
And I felt guilty about that.
Yeah, and isolated.
Yeah, definitely.
I'm guessing, I don't know your age, but I'm guessing this is pre-social media, at least, so in terms of being able to... Just about. But in terms of, like, I'm just thinking of now, like, the awareness that's out there, it's a lot easier. Whatever issue you're facing, you can find a tribe, can't you? You can find your people who are in the same boat and not feel quite as alone. But
definitely. And that I would say that, because I found out about PMDD because of Instagram, and social media has such a bad rap, but at the same time, like, I can't fault it for that. And I remember when I created my Instagram account, which was for PMDD, but it was anonymous and I didn't put my face on it or anything like that, because I wasn't quite ready to almost, like, get out of the PMDD closet, but I wanted to be involved in the conversations, and the support was incredible. And I've got friends from all over the world who I've never met in person, probably never will, but I know that I can text them on day 26 and just be like, I'm day 26 of my cycle, and they'll know what to say, they'll know what I'm going through.
Yeah.
And that's so powerful. So I will always be grateful for that.
Yeah.
To social media for that.
But it really is, because I think you need that support, don't you? And finding people who really understand. Obviously, you know, your loved ones, your partners could see you going through it and could be understanding, but there's no understanding like someone who's actually going through it as well.
Yeah, definitely.
Yeah. So it sounds like really I normally ask if you've got brave as you've got older, but it sounds like you've had to be brave all your life just to be here from the thoughts you were facing.
I think people have to be brave every day. And I think, I mean, when I picture the word bravery, what I picture is Simba from The Lion King. You know that scene when his dad dies and he's like, he has to be really brave. That's what I picture. But then I was like, bravery doesn't have to be that. It doesn't have to be that big. Bravery is, you know, stepping out of your comfort zone. It could be something huge. It could be overcoming, like, adversity, but also it's something like putting yourself out there when you feel like you don't want to. It's showing up for yourself when you don't want to. All those things are brave, and that's things people do every single day, isn't it?
Yeah. Well, I think has been a theme, and it has been interesting to listen, because I guess I didn't know when I posed the question what people would say, and I guess probably in my mind I was thinking of some life-changing moment, but I think there has been a theme of sometimes it's just getting out of bed.
Yeah.
Takes bravery.
Yeah.
So and I think it's a sliding scale, isn't it, as we go through life as well, because I think you said once you'd post-lockdown you'd started to say yes to things that you would have said no to before. Have you got any good examples of that?
I think and you know, I think a lot of that is like setting up that Instagram account where I was anonymous, and then realising that if I wanted to raise awareness and, you know, smash the taboo, I had to have a face, because that was the whole point of being honest and putting yourself out there. So I think that's one moment where I was kind of like, yeah, I'm really glad I did that, because then I started my podcast, and I wouldn't have done my podcast if I hadn't have been, you know, on Instagram properly. And if I hadn't have started my podcast, which I had no clue how to do that, I was just like, I just want to talk with some other people who've got PMDD, and yeah, and then that was like led me to being self-employed, and I remember thinking, oh, I can't be self-employed, I don't know what to do, I don't know how to do my taxes and all that kind of stuff. But actually all of those little moments were pushing that comfort zone a little bit more and a little bit more. And I think actually over the last couple of years with being self-employed and being a business owner, you really have to push that comfort zone, because you're not just showing up for yourself, you're showing up for your business. And when you're showing up for your business, that means money and your family. So there's a lot riding on it.
There's no safety net.
Exactly. So you have to do these things. And I talk a lot in the work that I do about imposter syndrome. And I think there's a huge thing, especially with entrepreneurs and especially with women who are just kind of like, oh, I know I need to do that, but I can't, or I don't know how, so I just don't take the action. And I've had to be really, I've really had to like call that out when that's me, and kind of be like, if I'm not doing that just because my mind tells me I can't, I'm doing it.
Yeah,
basically.
That's a red flag. Yeah. It's doable. I'm going to do it anyway.
Yeah, that's the only reason I'm not doing it, because I've got self-doubt, then I'm doing it. And that's really uncomfortable. But I don't regret any of those decisions. It's only led to good things in the end. So that says a lot, doesn't it? That sometimes the self-doubt is just, that's all it is. It's just some self-doubt.
Yeah, and I think it's a bit like mixed messages, isn't it? Because I've been trying to say yes more to things that I wouldn't normally do, but then I'm also trying to put boundaries in place as a people pleaser of saying no to things that I don't want to do. But I guess maybe saying no to those things frees up the time to say yes to the other things.
You're saying yes to you, aren't you?
Yeah.
Which sometimes means saying yes to things, and sometimes it'll mean saying no, but ultimately it's saying yes to you and your boundaries and your worth. So
yeah.